This medication is used to treat a rare genetic disorder called lysosomal acid lipase deficiency, LAL-D. Kanuma 2 mg per milliliter intravenous solution is an enzyme replacement therapy that replaces a missing enzyme called lysosomal acid lipase in people with LAL-D. This helps the body to break down fats, preventing liver damage and high blood cholesterol levels. It is important to follow the prescribed daily dosage and take it at the optimal timing recommended by your healthcare provider. Before starting the treatment with Lipase alpha, make sure to read the patient information leaflet provided by your pharmacist. This medication is administered through an injection into a vein as directed by your doctor, usually once a week or once every other week. The injection is given by a healthcare professional over a period of 2 hours. The dosage will be determined based on your medical condition, age, weight, and how you respond to the treatment. While receiving Lipase alpha, you may experience infusion reactions or serious allergic reactions. It's important to be monitored carefully by a healthcare professional during and after the infusion. If you experience symptoms such as chest pain, fast heartbeat, stomach pain, mental/mood changes, fever, chills, or nausea, seek medical help right away. Your doctor may slow down or stop your treatment for some time if you experience serious side effects and may also prescribe other medications before each treatment to help prevent these side effects. It's important to use this medication regularly in order to get the most benefit from it. To help you remember, mark the days on a calendar when you need to receive this medication. If your condition worsens, make sure to inform your doctor. If you experience headache, dizziness, or cold symptoms while using Kanuma 2 mg per milliliter intravenous solution, let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While allergic reactions to this drug are rare, seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting treatment with Kanuma 2 mg per milliliter intravenous solution, it's important to let your doctor know if you have any allergies, particularly to egg products. This medication may also contain inactive ingredients that could cause allergic reactions or other issues. Make sure to discuss this with your pharmacist for more information. Additionally, it's important to discuss your medical history with your doctor or pharmacist before using this medication. While using Kanuma, you may experience dizziness, especially when combined with alcohol or marijuana, cannabis. It's important to avoid driving, using machinery, or anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, make sure to talk to your doctor about it. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Kanuma should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Lastly, it's not known whether this medication passes into breast milk, so make sure to consult your doctor before breastfeeding if you are using Kanuma. When taking Kanuma, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. This will help them assess any potential interactions and make sure that the dosage of your medications is appropriate. It's important to follow your doctor's guidance and not make any changes to your medications without their approval. If someone takes too much Kanuma and experiences severe symptoms like fainting or difficulty breathing, it is important to seek emergency medical help by calling 911. Otherwise, contact a poison control center immediately. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Before starting Kanuma 2 mg per milliliter intravenous solution, your doctor will need to conduct various lab and medical tests to monitor your cholesterol and triglyceride levels, liver function, as well as your height and weight. It's important to keep all your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Kanuma 2 mg per milliliter as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is administered in a medical facility and is not intended for home storage. It is used to treat lysosomal acid lipase deficiency and is given as an intravenous solution. The dosage and timing of administration will be determined by a healthcare professional based on individual needs and medical history. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.